Division of Interventional Pulmonology, Fortis Memorial Research Institute, Gurugram. Normal lung parenchyma appears as a whitish image with numerous white hyperechoic particles. Due to air-filled alveoli, this is typically called snowstorm appearance. Peripheral lesion. Once a peripheral lung lesion is reached with the radial probe, the ultrasonic picture usually changes to a gray image, especially if it is a solid lesion. Interpretation of radial ultrasonic image. The benign and malignant lesions can be differentiated by ultrasonic interpretation of the margin, internal morphology and internal echoes of the images obtained by radial probe. The margin of an image can be of two types: hyperechoic and blurred. The hyperechoic margin is a bright border outside the lesion at its periphery. This is produced due to the strong reflection of echoes from adjacent atelectasis of the normal aerated tissue by a mass-like lesion. Blurred margin lacks a well-defined border and is seen the majority of times with benign lesions. The internal morphology of the image can be classified into three patterns. Type 1 is a homogeneous pattern. Type 2 is hyperechoic dots and linear arc patterns, and Type 3 is the heterogeneous pattern. Type 1. The homogeneous pattern appears uniformly gray morphology with absent or scanty hyperechoic areas due to the absence of air bronchogram sign, and is suggestive of a malignant pathology. Type 2 morphology of ultrasound image is identified as hyperechoic dots and linear arc pattern. Hyperechoic dots are visible as sharp white echo spots, usually 1 mm in diameter, and produced by trapped air in small bronchi in a consolidated area. Hyperechoic arcs are formed by the merging of hyperechoic dots, usually around the probe, and are produced by a random presence of exudate-filled and air-filled alveoli. Concentric circles are formed by the merging of hyperechoic dots around the radial probe due to the presence of preserved, intact architecture of the bronchioles. Most cases involving type 2 internal hyperechoic dots, linear arcs and concentric circles represent benign lesions. Type 3. Heterogeneous pattern has irregularly distributed areas of hypoechoic and hyperechoic mottling within the lesion, corresponding to compressed or stenotic bronchi and alveolar air. Ultrasonic characteristics of malignant lesions include hyperechoic margin, homogeneous gray internal echoes, and absent or scant mottled and hyperechoic areas. There is no air bronchogram, which is a distinguishing sign for inflammatory disease or atelectasis. Ultrasonic image in benign lesions shows blurred margins, heterogeneous internal echoes, hyperechoic dots, and arcs and concentric circles. The blizzard sign is characterized by a noticeable increase in the whiteout intensity compared to the normal snowstorm echoes and an increase in radius of the whitish acoustic shadow. This blizzard sign is typically due to a GGO suggestive of adenocarcinoma. Necrosis appears as an echo-free circumscribed black area, characteristic of squamous cell carcinoma. A blood vessel is visible as an echo-free circumscribed area, characterized by arterial vascular pulsation concurrent with the patient's heartbeat. Sometimes the blood vessel is seen coursing through the lesion.